Hello there, and welcome. My name is Dr. Calliope, and I'm going to be your osteopathic doctor today. How are you doing today? Okay, I hope by the time you leave my office you feel even just the littlest bit better. Alright? Okay, so if you wouldn't mind, if you could just give me your name and date of birth. Excellent. Thank you. And is that your preferred name, and how do you like to be addressed? Perfect. Okay. So, what is the reason that you sought me out today? Okay. Just be writing this down. Okay. Okay, excellent. So that is certainly something that we can treat with OMM, or Osteopathic Manipulative Medicine, which is what I practice. So if you wouldn't mind, I'd like to explain a little bit about what it is that I do, okay? Just to give you a better understanding of what I tend to treat and what my background is, okay? All right, so I am a doctor of osteopathy, and that means that I am a real physician. I went to a real medical school and got real medical training, did all the schooling, the residency, everything that your family physician might, or someone else who works at a hospital, okay? Now, my particular training tended to focus on osteopathic manipulative medicine. And to a layperson, it might look a lot like chiropractic. Now, the difference is I have much more training, and chiropractors go to a chiropractic school, right? Whereas I have a lot more training in anatomy, general medicine, as well as the manipulative medicine, okay? So with chiropractors, they tend to use more high velocity, low amplitude thrusts. Those are the typical cracking sounds you think of when you think of a chiropractor, with that sudden movement that ends up making that noise, right? Now, while I can do high velocity, low amplitude thrusts, I tend to use a lot more different techniques. So I would say, rather than a chiropractor, my job looks a lot more like, say, your regular doctor mixed with a physical therapist, okay? So I use different techniques like soft tissue work. We can do myofascial release. We have over 40 different techniques that we can use to get you feeling a lot healthier and a lot better, okay? Yeah, osteopathy focuses on the body as a whole. We're not looking at, oh, you have a stomach ache, so we're only going to focus on the stomach. We're looking at everything that could be. We're looking at everything that it could affect. We're looking at the entire picture. It's a holistic approach to medicine. We focus on each of the systems, how they work together, and how we can make them work the best that they can, okay? I know that's a lot of information. The most you need to know is I'm a real doctor, and I'm going to be looking at you as a holistic unit rather than just some parts that work together, okay? All right, so I often focus a lot on musculoskeletal issues. I see a lot of people with neck pain, back pain, headaches, even carpal tunnel, tendinitis, okay? But I can treat a wide variety of different illnesses, okay? Any questions for me so far? Wonderful. If at any point you do, just let me know. I know, again, a lot of information, okay? I'll let you process. So I would like to ask you some questions about your malady here, okay? So I would like you to tell me about all the symptoms you've been experiencing with your pain, okay? Even if you don't think that it's necessarily attributed to the pain you're experiencing, I want you to let me know anyway, okay? All right. Okay. All right. And would you mind telling me where all of that is then? Okay, so right in this area here and a little up to the head. Okay, so would I be right in saying that that pain kind of radiates? Okay, so it's not just localized, right? Okay, does it come down the back at all? A little bit? Okay, how far down would you say? Okay, very good. I'll do more investigating when we get there, but that gives me a good place to start. Just note that down. Okay, very good. Now, on a scale from 1 to 10, how bad is this pain in general, okay? From 1 being not painful at all, and 10 being extremely painful. Most pain you've ever experienced. Okay. Very good. And approximately when did this start for you? Okay, a few months ago. Okay. And is there any particular time of day or after perhaps some sort of event, maybe after you work out, after you get off work, any time where that pain is worse for you? Okay. Okay. Thank you. And anything that makes it better at all? Any time of day, rather. Okay. Okay, very good. Excellent. And have you tried any sort of treatment at all? And have there been any that worked for you? Okay, so medicine's not so much. Okay. Rest, yeah, definitely. It's usually one of the best treatments for any malady, really. Okay, anything else? Okay, very good. Excellent. So, I'm going to go ahead and sanitize my hands, and then we will take a little look at you, okay? All right. So from this point onwards, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, wonderful. So for our examination, in osteopathy, we tend to want to see the body in more sort of positions and motions than just you sitting here on the table, okay? So I will take a look at you as we're sitting here. I'll also do an examination where you are standing, and we're going to see your movement, okay? And then I'm also going to examine you while you're lying down, okay? There's a lot of what I'm thinking that we're going to be looking for is going to be in the muscles, okay? The muscles and the structures. So they're going to look different when you're sitting, they're going to look different when you're standing, and when you're lying down. So I want to see how all those different systems are operating in different positions, okay? All right, so for this part of the exam, I'm not going to use any gloves because I need to really get in to the muscles, the skin, the fascia, and feel around. However, if it makes you uncomfortable, I can put on some gloves. Okay, no problem. You just let me know, all right? Now, there might be some discomfort, especially when I'm prodding around. You just let me know if there's anything that you can't handle, that's too much pain, okay? All right, so I'm going to get a little closer. And we're going to start. I'm just going to have a feel right back behind your head here. So you said most of what you're experiencing is right in this area, correct? Right here? Okay. And how does that feel when I palpate around there? How does that feel for you? Okay, maybe a little sore, okay? And if I come down, how does that feel? Okay, not as much. And what if I come up? How does this feel for you? Okay, so that's a little tight, a little tense. Okay, so not so much with the upper back. And let me check around your shoulders here. So they are a little tense. I can see that you're holding them up a little higher, okay? If I push them down, how does that feel for you? Okay, it's a little stiff. Okay, so yeah, normally our shoulders should be able to be a little rolled back and pulled down a little bit, but if they've been hunched up for so long, I could see that maybe the muscles are a little shortened, a little stiff. It's harder to bring it back into a healthier position. We can definitely work on that a little. But right now, our biggest concern is right around the base of the skull, right up to the occiput and a little bit down the neck. Okay. All right, that feels, there's definitely some knotting in the muscle there as well. Okay, I'm just going to get up and I'm going to come to the side, okay? And I'm going to do a little more investigating, all right? Need just a moment. Okay, so I'm just going to put my hand right at your forehead so I can feel around a little better, but your head's supported. Okay. All right, so let's do a little range of movement, okay? So let's go ahead and bring your head down. Good, and back up. Okay, are we feeling any pain or tenderness in this? Not really? Okay. And what if we turn you to the side? Okay, a little bit on that side. And back to neutral. And the other side. How's that? Little stiff. Okay. Alrighty, let's go ahead and bring you to tilt. Okay, a little stiff, back to neutral, and tilt. Okay, little stiff there as well. Alright, so I really want to have a little look at your AA joint in particular when we get you lying down. That'll be the easiest way for me to isolate that. So, okay. So right in here, down here, we're looking at this area in particular. Okay. So I'm going to come back just for a second. So I'm going to have you go ahead and stand up for me. Okay. And then I'll just be rechecking around here. Stand up for me. Good, okay. So let's feel around. So I noticed both when you're sitting, your posture is a little hunched, and also when you're standing, your head's a little bit forward. So we'll want to work on bringing that head back, okay? Our heads are like a bowling ball on top of this little stick that is our neck, right? And our heads, the more we push them forward, the more force we put on the neck, the more tension, and you get a lot of pain, a lot of structural issues, okay? So we want to try to bring your head back as much as we can so that it's in line with the rest of the body, okay? We want your whole body to be aligned and straight without being stiff, okay? All right, so I'm going to sit down and I'm going to have you do a little bit of movement for me, okay? If you wouldn't mind just walking to the end of the room for me. Yep, and I'm just going to watch your gait. I'm going to watch your movement, right? If you could just do that for me. Good, and if you could come back for me. Okay, and how does that feel for you? Any pain? Okay, so just like a little bit upon impact of the footfall. Okay, I can see that, especially if you have headaches that are going along with this pain. Okay, so if you want to go ahead and sit back down for me. Okay, and now we're going to get you to lie down. All right. Yeah, so I'm gonna have you lie down on the table. And then we're going to do a little more looking at your neck, your shoulders, your back, and your head, okay? And I'll look a little bit more into your atlas axis joint or your AA joint. And we'll look a little more into that occiput as well, okay? All right, I'll give you just a moment to get settled, okay? All right, so I've got you on the table here, and I'm going to have you just come back a little bit so you're closer to me. Okay, yep, I'll stop you right there. Okay, so this gives me the best access to you. You're still secure. I'm not going to let you fall off at all. Okay, so I'm going to be feeling into your neck. It might almost feel a little bit like a massage, I want to feel around the vertebrae here. This tends to be one of the areas where I can feel it a lot easier when you're lying down. Your muscles are a little more relaxed, okay? So I'm going to feel around. We're going to go all the way down to where your back really meets the table. You got that little bit of space where your neck curves. I'll come all the way down there because that tends to be where it stops for you. Okay. Are you feeling any pain or any discomfort in any of this? Okay. All right, so I'm just gonna hold your head up a little bit and I'm gonna feel around the occiput. Okay, so yeah, that's really tight. That's really tense in there. So what I think is going on with you is it feels like you have so much tension in your muscles here, especially in the head, that it's causing a lot of these symptoms, a lot of this pain. And this was happening well before you started experiencing the pain, the headaches, and the little bit of loss of movement. So we can get these muscles to relax a little bit. It's going to take a little bit of time, but we can do some stretches. We can do some medication if you would like. That's not necessarily needed though, but with more tough cases, that's a good way to go. And with some adjustment, I think we can get you into a much better place. So I don't know if you know this, but little fun fact, most headaches are caused by muscle tension. They're mostly tension headaches. And tension headaches are usually treated with sometimes medicine. It's not exactly the best course of treatment we can do, but stretching and physical therapy exercises tend to fix it up rather quickly in a matter of weeks. Okay? So this is definitely something we can treat. So I want to take a look around just a little bit more. Since we have that tension, I'm gonna look at your shoulders as well, and I'm gonna look at your jaw. Okay, let me come into your jaw here. Do you have trouble with opening and closing your jaw at all? Okay, interesting. So I'm going to just hold your masseter muscle here, okay? And I want you to open your mouth for me. And close. Open. And close. Open. And close. Okay. How was that for you? Yeah, I did feel there's definitely some tension in there, and I can tell you're not opening your mouth as wide as I would expect you to, but that's also something we can work on, and that definitely could be contributing to the headaches and the pain. I'm going to put my hands on your temporalis muscle. This is by your temples, okay? And I want you to go ahead and open your mouth and close your mouth. Open your mouth. Close your mouth. Okay, so yeah, less so up here, but definitely that TMJ joint is very tense, and we can work a little with that as well. Okay, so from here we can work on our treatment, okay? So I'm going to start by warming up the tissues, and this is called soft tissue work. So it may feel like a deep tissue massage. One could certainly call it that, but I'm going to work along your neck up into your head, okay? All right, so just go in sort of specific direction, almost like a go in, up, and back, so I can really get into the muscles and warm up the tissues so we can unstick this a little bit, okay? So just do your best to relax. There might be some parts where it's a little uncomfortable because we're working with tissues that have been tight and tense and clenched for so long, and we're manually trying to tell them to relax. The body is a really wonderful thing, but sometimes it needs a little help. So when the body feels that there is something wrong, then oftentimes it will compensate. So for example, if you're having trouble with one side of your body, oftentimes the other side will compensate, which works for a little while, but it can make the problem so much worse. But your body's just trying to do the best it can with what it's got, and these are the only instructions it has. When this thing starts going wrong, do this, even though it's counterintuitive. So that's when we come in and we manually adjust the body. We see what sort of muscles are working a little too hard and what ones we need to develop. And from there we can get you to be a lot more balanced. Okay, I'm just going to come up into the occipital area. We worked mostly on those paraspinal muscles. Now we're working up in here. So it's not uncommon whatsoever for people to have very tense occipital areas. A lot of times it's caused by pillows that aren't really working for our anatomy and the way that we hold our head sometimes when we're lying down. I don't know about you, but I'm pretty bad about craning my neck when I'm lying down so I can look at my phone or read. And that's not very good for those muscles. But with some stretching, we can work on the muscles that should be engaging rather than these muscles that are trying to compensate. How is this feeling for you? Okay, it's a little tender. I imagine so. Is it bearable? Okay, all right, that's what we want. We don't want to make you feel like you're in a lot of pain the whole time. That's not going to help us. But if it's just some soreness, then that's what we expect. Okay, very good. So I am going to do a little hold here, okay? And I'm going to try to press into those muscles and wait for them to release, okay? Usually this takes about 30 seconds, all right? So you'll feel quite a bit of pressure in this, okay? Not so much from the pressure that I'm giving, but just from the tension of the muscles, okay? I'm going to press in. Okay. And I'll go ahead and release that. So that came out a lot quicker than I thought it was going to. That's good. All right, so I want to isolate your AA joint a little bit. And we're going to do a little bit of work with this, okay? So I'm going to have one hand below your head. I'm going to have one hand on top, okay? And what we're going to do is I'm going to turn your head to the right, okay? I'm going to turn you to the right. And I am going to have you try to turn your head left, okay? I'm going to hold you here though, so we're isolating those little muscles there, okay? And we're getting those isometric contractions. So I'm going to hold your head here. I'm going to have you turn your head to the left, and we're going to hold that for 5 seconds, okay? Alrighty, so I'm going to have you go ahead and hold. Good. 2, 3, 4, 5. And release. And then your head just kind of turns a little bit better, right? So we're using your body's own muscle energy to work through that restriction, okay? We're going to do that again. So I'm going to have you go ahead and turn your head to the left and hold. 2, 3. Okay, and release. And then it comes back just a little bit more. Good. And if I could have you do that one more time for me. Go ahead and turn your head to the left. Hold that. 2, 3, 4. And release. Good. So we already got a lot more movement in there. I'm going to turn your head back to neutral. Okay. I'll give you a moment. And then we'll do the same on the other side. All right. So I'm going to have you turn your head to the left now. And then I'm going to hold your head. And I want you to turn your head towards the right and hold. Okay? Turn your head towards the right. 1, 2, 3, 4, 5. And release. Okay, this side wasn't as stiff to begin with, so that's good. So I'm going to have you turn your head towards the right. Very good, and release. One more time. Turn your head towards the right. And release. Very good. All right, let's check your restriction a little bit again. Okay, I'm going to turn you. Good, and turn. Turn. Okay, so we have a little bit more going on in here. Okay, so since we had looked at your jaw a little bit and found that was pretty tight, I'm going to go ahead and put on some gloves real quick, and we're going to do some work inside your mouth. It won't take too long. Okay, so I'm going to have you open your mouth as wide as you can for me. Okay, and I'm just going to work one side at a time. I'm going to support you here, and I'm going to press down right at the back, okay? We're going to do some myofascial release, the inside of your mouth, okay? Open your mouth wide. And this is going to feel a little strange, okay? It might be pretty sore, but we're going to hold this until it starts loosening up, and then we can start to see more movement. We'll be able to work with it a lot easier. Okay. You might feel me just adjusting a little bit. Okay. A little bit longer. Okay, and you can go ahead and close your mouth for a moment. It's going to feel a little strange on that side, but when we do the other side, then they'll both feel about equal. Okay. All right, so if I can have you open your mouth again. Okay, so I'm just going to feel in here. We're going to press down into those soft tissues at the back of the mouth. On the side there. So we'll get you on a little regimen of some simple exercises. Okay. And then by the time I see you again, we should see some improvement and be able to get a little bit more movement. So your symptoms aren't going to vanish overnight, okay? Usually takes at least a couple weeks, but the more you are diligent about your exercises and making sure that you keep your appointments, then we can get you to a much better place. And when you keep up with those exercises, then it'll take a lot longer for those symptoms to come back in, if they do at all. So when we treat those reasons that we had the pain and the problems in the first place, then there shouldn't be any reason why they come back. Okay. All right, go ahead and close your mouth. I'm going to take these off. Okay, how does that feel? Feels a little strange, doesn't it? Yeah. Okay, so I'm going to give you a moment, and then you can come back to sitting, and we'll talk about some exercises, okay? All right. Okay, so how's that all feeling now that you're sitting? Okay, yeah, it's a little strange, isn't it? Yeah. So, as far as your exercises go, we're gonna do one type for your jaw. We're gonna do one type for your neck. And we're gonna do one type for your AA joint. Okay? You have any preference as to which I show you first? Okay, we'll start with the jaw. So with the jaw, we're going to work on stretching those jaw muscles, okay? So what I'm going to have you do is I'll have you take the opposite hand of the side you're working on. So for example, this is my left side, so I'll use my right side. You're going to put your thumb on your canine tooth, and your index finger on the very last tooth in the back of your mouth. Okay? You do that for me? Finger on canine, your thumb on canine rather, and finger on the back. Okay? It's a little bit of a strange motion. Okay? So I'm going to have you open your mouth and stretch that out to the best that you can. Okay? I don't want you to go so far that it's very painful. We're going to do this slowly. Okay? I'm going to have you open your mouth and stretch for the count of 3. Okay? So stretch, 1, 2, 3, and rest. And then come back in, stretch, 1, 2, 3, and rest. And stretch, 1, 2, 3, and rest. Okay? And then we're going to do that on the other side. So opposite hand of the side you're working on, thumb on your canine tooth right here, and finger on your last tooth in the back of your mouth. We're going to stretch the count of 3. Stretch, 1, 2, 3. Rest. Stretch, 1, 2, 3. Rest. Stretch, 1, 2, 3, and rest. Okay? After you do that, I'm going to have you find this little point right by your ears. So when you open your jaw, you feel some movement right by your ears. Okay? I'm going to have you press into that. I'm going to have you put your tongue to the roof of your mouth, and I'm going to have you open and close your jaw about 5 times, okay? So, like that, 5 times. All right? So that's for your jaw. Now, when we get into the neck, I won't be able to really show you in a great way here. Let's have you go ahead and lie down and I'll show you that one. Okay, so I'm going to roll up this little towel here, and it's just a little bolster to go behind the neck. So if you want to roll up like a little hand towel and put it behind the neck. Okay, so I'm going to have you put your hand on the side of your head, okay? Same hand, same side. So right at the temple. And I'm going to have you just turn towards that way. But we're going to use about 30% of your muscles' energy, of your strength, to hold your head and give you some resistance, okay? So we're going to be building up some more strength in the spinal muscles, all right? These little neck muscles, rather. Okay, so we'll hold your head, and then I'm going to have you turn against my resistance, and I'll show you about how much resistance you want. You're going to turn your head all the way to your range of movement, okay? So as far as you can go to the side. Go ahead and turn your head. Good. That's 1, 2, 3, 4, 5. Okay. We're going to do that on the opposite side. So we're going to put our hand against the temple, use about 30% of our strength. So the pressure that I'm at now, we're going to turn against that resistance as far as our head will go, okay? We'll do that 5 times. 1, 2, 3, 4, 5. Very good. Okay. So that's for our little neck muscles. I'll have you come back up and we'll do the AA joint exercise, okay? All right, so now for the AA joint, right in here, I'm going to have you hold your arms at your side with your hands pointing forward like this, okay? So arms bent at a 90-degree angle, hands pointing forward. And I'm going to have you, without twisting your body, without raising your shoulders, I'm going to have you reach forward with one hand, and with the other arm, I want you to pull back towards your spine, okay? So reach forward towards the center, pull back towards the spine with the other arm, okay? And remember not to let your shoulders come up, okay? So you might feel almost this bit of grinding right in this area right here. It's going to be a little strange, okay? So have our hands at our side. One hand reaches forward. The other arm pulls back towards the center of our spine. Okay, and we do this movement very slowly, okay? And it'll be pretty sore at first, and it may not go very far. But we're working on getting a little bit more movement in there, okay? Just like that. So we'll go each side about 5 times. And generally you alternate, okay? So once on this side, 1, 2, 3, 4, 5, or 1, 1, 2, 2, so on and so forth. However you want to count that out. Okay? So I know that's a lot to remember, but I have some printouts for you that tell you all about the exercises and how much we have to do them and which part they're for. So with the jaw, we're going to do the jaw stretch 5 to 6 times a day. And I know that seems like a lot, but when we're doing these regular, very small bits of exercise, it's going to do a lot more for you than doing 2 to 3 times where we go a lot longer, okay? And it only takes about a minute, so it doesn't take too much time at all. So the jaw stretch, the AA stretch, is going to be 5 to 6 times a day. And our neck stretch is going to be twice a day. Okay, so you can do that when you wake up, when you go to bed. All right? So, got that all ready to go. So I'll be sending that home with you. And that's going to be about it for your OMM treatment today. Do you have any questions for me at all? Okay, yeah. So ideally, I will be seeing you once a week, and we'll start out that way maybe for 2 to 3, maybe 4 times, okay? And we'll see how you're doing. If you're keeping up on your exercises, if your muscles are responding well to the treatment, to the exercise, then we can see about doing once every 2 weeks, and then we can get to a point where it's once a month, once every 2 months, okay? I'll have to highlight that the more you keep up on these exercises, the longer we can see your symptomless or reduction of symptoms persist, okay? All right, so I think that we will get you feeling a lot better, if not completely, okay? Pretty quickly. Anything else? Okay, excellent. Thank you so much for choosing me as your Doctor of Osteopathy today. I hope we can get you on the road to recovery pretty quickly, and we can see you in a much less painful or even pain-free life, okay? All right. Thank you so much. Hope you have a whale of a day and a good rest of your night.